Hey everyone. If you're watching this, you're probably juggling call, cases, consults, and 80-hour work weeks, and lack of sleep, and some vague guilt about not studying enough for the Absite. The Absite is a test of overall surgery knowledge, pattern recognition, consistency, and stamina. This video is about strategy and resources to make the most of your limited time, and what I wish I had known as a resident trying to maximize their Absite score without burning out. I'm not sponsored by any company, and this is purely an educational resource for my peers. I initially scored in the 20 to 29th percentile in Absite, but rapidly improved to at least 50th percentile in 1 year using this method. As you all know, Absite now is based on percentages only. Back when I took it, it was based on percentile initially, then switched over to percentages, but my percentile and percentage both went up every year that I used this method. In general, I feel that there are too many resources available. You do not have the time to sift through and complete more than one or two and lose time trying too many different strategies here and there. This is the strategy that worked for me. It is by no means the end all be all. Another strategy might actually work for you, but I did see results with this method and I saw them rapidly and noticeably. Now I'm entering my dream fellowship in my dream specialty. The Absite rewards several things. It rewards overall surgical knowledge. The more facts that you have, the more you can eliminate choices. It rewards stamina by being able to stay sharp for over 200 questions. And it rewards understanding surgical management in general. It also rewards recognizing clinical patterns quickly. In general, if you study randomly or passively, you will feel busy, but you will not actually make real progress and you will plateau. The goal is actually deliberate, repeatable exposure to exam logic. The foundation of Absite prep is a question bank. You want to do as many as possible, and most importantly, you want to review your notes or your incorrects daily or at least weekly. You should aim to complete truelearn or score, ideally both if you have the time, and you want to finish at least one of these question banks 1 month before exam day. That way you have 1 month to review your incorrects at a minimum. If you can only do one of these qbanks, truelearn versus score, that's fine. Stick with one. Consistency matters more than sheer volume. If you have time, I would add Absite Quest and Devirgilio or SESAP. I would add Devirgilio or CSAP if you are a PGY3 and above. It's even better if you can do your incorrects or review your notes every day, but at least weekly is critical. A realistic target is 5 to 10 questions on post call days, 10 to 20 questions on lighter days, and more than that on the weekend if you have time or if you need to catch up. The key point is that finishing incorrects is non-negotiable. If you do nothing else, make sure you review every incorrect question at least once before the exam. The incorrects are where you hammer your weak points and memorize it via exposure. This is the fastest way to improve. Also, the incorrects are going to reveal your knowledge gaps and teach you key patterns. Each question has some phrase or some clue in the question stem that is purposely put there by the question writers to eliminate at least one answer choice. So by reviewing your incorrects, you pick up on these clues and patterns quickly. You have to review critically enough to be able to catch these and recognize these. So how do we review questions correctly? You want to read rapidly and quickly and not get bogged down in the answer stem. Do not reread explanations just passively. Instead, for every incorrect answer, you want to ask yourself, did I miss a key clue in the stem? Did I know the concept but choose the wrong answer? Or did I not know this at all? Your goal is not necessarily direct memorization, but rather recognizing why the wrong answer was tempting and why the correct answer actually won. If you can articulate that difference in one quick sentence, you should write that down and show yourself that you're actually learning the test and progressing. You should then review that one sentence frequently, at least once a week or daily, to hammer that home in your mind. For instance, some questions will ask the difference between transfusion associated circulatory overload versus transfusion related acute lung injury, TACO versus trolley. The question stem will include a line about how there is concomitant fluid overload, and that will point you to taco. You should then, in your notes, write a sentence that says, fluid overload evidence points you to taco. And you should review that daily or once a week or however you have time to review your notes so that you can hammer that key differentiator in your mind. You should then have also, as you review questions, an answer in your mind already as you read the question stem. Also, if you get lost, you should read the last sentence in the question stem first to kind of reorient yourself to what the question is asking. You should be able to go through all of your incorrects at least once before the exam. This will help you reinforce your missed learning points and help you increase your score as quickly as possible. So, some quick thoughts on audio learning. I think that audio learning was very valuable to improving my own score. In my opinion, you should be listening to the Behind the Knife Absite review series at least twice before the exam. They provide very high quality, high yield material. I know some residents use this as a primary study material actually before they hit the question banks. The reality is, at least for me, it went in through one ear and out the other, unless you are truly an auditory learner. It's very easy, in my opinion, to fall into a passive learning trap with these audio resources. So for me, I had to actually sit down and take notes each time I listened to one of the Behind the Knife episodes. And ideally, what I recommend you do is transcribe each of the episodes into OneNote or a Word document, and then turn those into Anki flashcards or typed notes that you can review at least once or twice before the exam. If you are going to listen to it in the car or on a trip, you should try to make it as active by answering the questions out loud before the speaker gives the answer. That way, you kind of turn it into an active recall exercise. So, some thoughts about what I would stop doing or what I wish I had not done. One, I wish I did not try to use too many resources. There's so many Absite resources out there, and actually, most of them will not make a real difference for you, and in fact, are a net negative because you'll waste time trying to utilize it, trying to skim it, trying to memorize these minute details that are not actually high yield. You should focus on minimizing your resources. Use the Behind the Knife podcast Absite episodes or the Behind the Knife oral board review series. Then you should use either truelearn or Score, and if you have time, you should use Absite Quest, Devirgilio, or SESAP. The last two resources, especially if you are a PGY3 or above. I personally did not use textbooks like Savastin's or Schwartz. These can be valuable if you do have the time and bandwidth, but I did not. Secondly, I think it's a mistake to try and wait for a lighter rotation to start studying for the Absite. You will not actually end up having a truly lighter rotation, or you will not actually have the time or bandwidth to make significant progress during a lighter rotation. You should just make this into a habit as best you can every day or nearly as often as possible. It's okay if you miss a day, just make up for it on your day off or on the next day you have. Finally, passively reading without doing questions or not making things active is a big mistake, in my opinion. If it's not tied to decision making, it won't move your score. It is your incorrects and reviewing all of your incorrects critically that will move your score. Overall, if I could give you one message, it would be to hit fewer resources, but hit them hard and think actively every time you're hitting them. A realistic study week might look like this, especially considering that we're all working 80 hours a week. You want to do daily questions. Even if you can just do five, that's good. Even if you miss a day, that's fine. You can make it up the next day or on your day off. Just try not to let it add up too far. And then if you're weak in an area, you can listen to the relevant Behind the Knife episode on it first, then hit the questions. Whether it's tutor mode or exam mode, whatever it takes to just get some of the questions in and make progress is most important. Closer to the exam, however, I would push myself personally to do anywhere from 40 to 100 questions a night on exam mode and timed. I was moving quickly and I was only really reviewing my incorrects. This also helps you build stamina for the 200 plus questions on exam day and also get ready for preparing your mind for exam mode. In future videos, I'll break down specific topics on the exam, like pancreas, esophagus, trauma, purely from the lens of how to answer the questions correctly. So to recap, my advice to you based on my experience is to do at least one question bank entirely. Frequent reviews of incorrects is absolutely critical and the most important thing to improving your score as quickly as possible. I would do behind the knife audio episodes, both the Absite episodes and the oral board review series if you can afford it, and take notes and review those notes as well, at least once or twice before the exam. The critical point is volume and intensity of questions and keeping it active. In general, hit fewer resources overall, but hit them hard. Good luck. If this was helpful for you, please consider subscribing. This channel is about simple and clear thinking and performing under pressure, not making surgery opaque and confusing.